starting the timer, and here is the question. So if you've read and understood, kindly begin your examination.
I will start with wash my hands. I will introduce myself. I'm
Yes.
Dr. Mavish. I'm one of the surgical candidate. Then I will check my patient's details and patient's age. Then I will take the verbal consent for my patient that today I'm going to I've been asked to examine your lower leg.
First, introduce yourself. I'm the examination candidate.
So my name is Mavish. I'm one of the exam candidate for today.
Yes.
And
Yes.
can I check your name and your age, please? And then I will start taking consent of my patient and ask
Yes.
patient that today your your lower leg, and I will be this will and your foot. This will include me having a look at your leg and then and feeling it, and then I will be doing a few tests on your leg. Then I will be listening to the arteries in your leg as well, and then I will be feeling the sensation in your foot as well.
Okay.
Do you have any pain anywhere?
No.
Um, so during the examination, if you feel any pain or you feel uncomfortable, please let me know and I will stop. Are you happy for me to proceed?
Okay. Yes.
Okay. So the exposure for this patient ideally should be the patient should be fully exposed and should be wearing knickers on, and
Yes.
the position
Shorts.
should be
Yes.
shorts on. So I will be the position of the patient should be ideally standing at first, if the patient, and then and then laying afterwards.
Yes.
So I will start my examination by inspection of this patient's leg. So the patient is having dressing wrapped on. I would like to get it removed and have a look on it
Yes.
on the whole leg. I will ideally come to the level of the patient's leg, and I will look from all the sides, from the front, from the sides, from the back, and I will look for first of all varicosities if they're present, blowouts. Then I will look for the signs of chronic limb ischemia on the patient's leg, which will include the hemosiderin deposition, any ulcers on the medial malleolus or the lateral malleolus, ideally on the medial malleolus in this case. Then I will be looking at any signs of itching or eczema, any edema on the leg. Then I will be looking for any atrophic blanching on the leg. After this, I will be looking at patients' groin for saphenina varix, if there is any swelling there. Then I will.
Patient, you have to rule out for. Okay, go on, please. Yes.
Sorry.
Yes, please continue. Yes.
Okay, so then after I've done this, I will start palpation of the patient's legs. I will palpate on to the leg for any pain if the patient has, and then if there is any swellings on the patient's leg, which will indicate if there is a superficial thrombophlebitis this patient is having. Then after that, I will ask the patient to that I'm going to do a few tests on the legs, and I will ask the patient to lay down. And before elevating the patient's leg, because I'm going to do the Trendelenburg's test first. Before elevating the leg, I would ask the patient if they have any pain in their hip joint. Then then I will elevate the leg and then milk the veins, if there are any dilated veins, down towards the saphenofemoral junction. I will put my hand on the saphenofemoral junction and then will ask the patient to stand up. And I will look for any dilated veins, if there are any dilatation after the milking is being done. After I've done this, if there is any dilatation, that means that the saphenofemoral junction is not in. Are we not doing the varicose veins?
No, this is, I wanted you to read foot drop, rule out foot drop.
Okay.
That's why I thought maybe I'll stop you, but then I thought, okay, let it go. You will just tell me what you got to tell me and then we'll do it again.
Oh
You
my
had
God.
to,
No, you
yes,
do it.
yes, you had to rule out the foot drop.
Foot drop first.
Yes, please. No varicose veins. There are two different examinations. For foot drop, you start with the inspection, you start with the gait. In the beginning, you told me very well, okay, that you'll patient will be standing and then lying down, and only during inspection, patient will be standing. And then for all the rest of the points, patient will be lying down. So
Can you ask someone else to do the station then? Because I've
yes,
left it.
yes.
Ma'am, I can do. Ma'am, can I try this station actually? I must try here.
Would you want to? Okay.
Yes,
let
I
me
would want
start
to. It's new to me as well, but I would like to do it actually.
Okay.
Yeah.
Yes, they were already telling you. So all right. Okay. All right. Okay.
Yeah, that's the problem as
That's
well.
the
Now they have
problem.
told me.
Okay, they
So
told
it
you.
won't help me that much. Yeah.
Okay.
But what do you say? Should I do this or should I do the next one?
Doesn't matter. You do it, and then
Okay.
I'll ask Dr. Sunday or Dr. Abhishek to repeat it for you. So I'm starting the timer here.
Okay.
Continue, please.
Okay. Hello, my name is Dr. Astra and I'm one of the surgical doctors. Can you please confirm your name and your date of birth, please?
Yes, I'm John, 56 years old.
I will be examining your lower limbs, particularly your right leg, and this will involve looking, feeling, and moving your leg. It will also involve me touching over different parts of your leg, and if you feel at any pain anywhere, please let me know, or if you're having severe pain anywhere, please stop me as well.
Okay.
Is it okay if I continue?
Yes.
Okay, thank you. So first of all, I would like you to, the ideal exposure for the patient will be from the umbilicus to the feet, and
Yes.
he should be well area covered for privacy reason. And then I can ask, can I please ask you to just walk a little bit up to,
Yes.
just up to this little area, and then if you could turn around and come back to me, please.
Yes.
So I will
Tell
check the
them
gait
how
of the
to
patient.
walk. How do you want them
Yes.
to walk? Please.
Yes. So yes, so I would like you to walk in a straight line,
Yes.
basically, and just and then turn around, take a U-turn, and then come back me, just as you would normally do. And
And
the
then
patient that the patient is not having an intelligent gait or limping towards one side.
And
or,
then you'll
is
also
not,
reassure, I'll be here to hold you in case
Yes.
you are insecure or you are about to imbalance or fell. So you'll have the posture like that.
Okay. And it
with
might
the hands
the
stretched.
patient is having foot drop, so with that patient might be walking on his toes. So then
Yes.
I will ask the patient to come back, and then I will examine the patient's leg starting from the top. So I will examine for any scars, any swellings, any deformities in the knee or in the ankle. Then I will
And
look
wasting,
particularly
muscle wasting.
and any muscle wasting, any
Yes.
sinuses, and I will look particularly in the area of the head of fibula for any scar marks, any stab revulsions, or any
Use of clutches.
Yes, any use of crutches or accessory, if he is using
Walking
high
aids,
heel
yes.
boots or
Yes.
anything, walking aids or anything.
Yes.
And then I will look at the lower limb, and I will see for any wasting of the muscles, particularly
Right.
in the anterior part and in the lateral part of the leg. And if he is, and also towards the back of the leg, I will notice that, inspect it for any changes, any muscle wasting or any swelling, scars or any deformities. And as it's
Okay.
already told, the patient has stab avulsions on his shin. So I will notice that. And then I will come to the palpation. So in the palpation, first of all, I will ask the patient that I will generally just palpate your ankle joints just softly, and then just let me know if there is any pain, and then the knee joints. And for any warmth, any for checking the temperature and whether there is any warmth or any swelling in those areas, particularly along the area of the head of fibula. And then I will look at the popliteal fossa as well. Then I will go ahead and I will ask the patient to lie down. So can you please lie down on the couch for me? And I will
Yes.
ask you to do certain movements of the leg if that's okay. So I
Okay.
would like you to kindly raise your right leg up towards the sky and just keep it straight without bending it at me. And don't let me push it down. So I will
Okay.
check the hip flexion, and then I will ask the patient to pull the now straighten your leg down towards the ground, but and resist me from doing this. And now
Okay.
I'll check the hip extension. Then I will check the knee extension. So I will ask the patient to bend, and and don't let me to straighten out. And now I will knee. So I will let you to straighten your knee and do not let me to push it up. And
Good.
now I'll put one of my hand on the
Yes.
patient's foot, on the patient that can you please move your foot up towards your leg,
Yes.
with the movement towards up towards your leg, and see if patient is able to do that. And most probably it will be weak because patient having foot drop. And then I will ask the patient to move the to hand underneath the patient's sole of the foot and ask to push down.
Yes.
And then I will check for evasion. So I will put my hand to the side of the foot, and I will ask the patient to to apply it towards my hand.
Yes.
And this will also I will inner the
Yes.
patient to please move again, checking this in the leg. This will check the sensation, pairing it on both sides. So I will check it on the right first, and simultaneously I'll check it on the left side, and I'll ask the patient that do you feel the same on both sides or do you feel different? And then I'll move gradually up towards the anterior part first of the leg and then the lateral part to see that if patient has any loss of sensation anywhere. And with foot drop as well, there might be some of anterolateral border of the lower leg. Then I will move up and I will check sensation on the anterior part of thighs as
Okay.
check the coordination of the leg as well. So I will ask the patient that if you could please move your right and move it along your left leg to your ankle, and then do it the same with the other heel, and move it down towards the ankle. Now I would like you to I would like to check certain reflex in your lower limb, and for this I would it would not hurt you. I will use this in your muscles. So I will particularly check the ankle reflex.
Yes.
I will basically make the patient in a 8 figure, like I will bend the knees outwards and the foot point should be pointing outwards as see any plantar flexion or the contraction of the calf muscles if it is present. And similarly, then after doing this is all in the lying position, and then I can check the tone. I can check the tone of the lower limb as well. And for this, I can just do a rolling movement on along
Yes.
the
Leg
knee,
roll. Yes.
and I will if there is any weak movement of the foot or any very loose move, and I will ask the patient that please let your limb go loose and do not exert any force or pressure, and I will see the general tone. And
Good.
I can also check by doing a knee lift. So I will just say that I will give a small jerk to your knee forward and just let your leg loose. And I should see that the heel should still be on the ground. It shouldn't be
Yes.
can be a low tone. And I can also check the ankleness. So for this, I will going to hold your foot and I'm going to do a few striking movements upward towards 1 or 2 striking movements upwards your leg, and it will be a little uncomfortable, but it shouldn't hurt you. And I will see if there is more than 5 rhythmic contractions or
Good.
not, which can rule out an upper motor neuron nerve
Very good.
lesion.
Very
So
good.
after this, then at the end of my I will also feel the pulse.
All right. About time. You could
And
just,
I would
yeah.
say thank you so much for the explanation, and you can dress up.
Can you please present your case now?
So today I've seen Mr. Brown. He is a 53-year-old man who is had a surgery for radio frequency ablation, probably for varicose veins, and has multiple stab avulsions.
Yes.
Presented, he has.
I don't know. Is it me or is it?
And, hello. Hello.
I'm sorry, I got disconnected.
Yes. So on I noticed also that he had a large stepping gait, and he had also he was trying to move on his toes. So all of this points towards a common peroneal nerve injury. It could be a common peroneal nerve palsy, and this could be secondary to the operation that he has had. And all.
What are the differentials that you're going to consider?
So in this case, I could consider that there is this is a common peroneal nerve palsy. It could be, and this could be secondary to the operation that he has had for radio frequency ablation and stab avulsion that might have damaged the nerve where it is very superficial around the neck of the fibula. Reasons could be the fracture of the neck of the fibula itself at some stage, or maybe if he has had a previous fracture repair. He has been in a cast. His leg has been in a cast, in a long cast that has pressed on that area for a long time.
I am not asking the reasons. I said, what are the other differentials that you are going to consider, please?
Other differentials can be sciatic nerve root impingement as well from the top, and it can also be an inflammation of the piriformis, or it can be
L4 and 5 herniation.
L4, okay, L4 and L5 herniation.
There could be vitamin B12 deficiency, could be because of alcohol abuse, or could be because of central causes, other causes like diabetes mellitus or other. So can you tell me what are the common causes of foot drops?
Common causes of
Okay, you've
foot
already
drop.
told me. All right. What are the investigations that you're going to do?
So MRI, I think MRI of the lumbosacral spine, I can see for the sciatic nerve how it is coming from there, to see any nerve root compression over. And also I can do an X-ray of the lower leg, I guess, to see the situation, and if there is any nerve compression by the bones or any bone related issue.
Electrodiagnostic studies for that. Any blood analysis that you would ask for?
Yes, I can ask for the for the glucose, normal routine blood, FPC, UNA, and CRP, and glucose levels. I can ask vitamin B12 levels. I can ask for because of peripheral neuropathy. What else I can ask?
And to rule out if patient was alcoholic, or so that alcoholism as well. So what should be the treatment?
So there should be decompression of the nerve, but I don't know how to do it.
Ankle foot orthosis,
orthosis, okay.
To support the foot while walking and to reduce risk of falling. And then you can also consider physiotherapy for muscle training if there is weakness, or surgical treatment could be exploration or decompression or repair, or even the tendon transfer.
Okay.
Very good. Okay. Right. What are they saying now? Yes, EMG. Very good.
Yeah, she did very well,
Yes.
but she forgot test. Teenage test.
Tinnels. Yes. Yes.
I was
Oh,
about to say that.
Yes.
it is.
Yes.
Yeah.
I was with, yes, very good. Yes. She did very well. It's just that she took little extra time, 2 minutes extra, and then
Yeah,
she forgot Tinnels. Because these girls, they have been studying themselves, they haven't been practicing. So when you're not practicing, you take more time.
yeah. And one more thing.
Yes, please.
Did she ask the patient to walk on heel and toes?
She did ask, yes, to walk, and then she said she'll note the gait if patient is
Yeah,
walking on toes
yeah.
or on heel.
Yeah.
So yes,
And,
that has been covered.
but that means for these patients with a peroneal nerve injury,
Can you
walk
speak
on
louder,
heel.
please?
Patient with a common peroneal nerve injury
Yes,
will
yes.
not be able to walk on. Patient will be able to walk on toes because of
Yeah,
intact tibial nerve, but patient will not be able to walk on heels. So
heels.
that's
Yes,
one of the
yes,
symptoms.
yes.
Yeah,
Ma'am,
she
can
didn't
you
mention
please
that.
write the management of this? I'm not familiar with any or orthodosis you said of
Yes,
the.
all of this is given in Dr. Bazir's notes, page
Okay,
35.
okay, okay, okay.
Yes, just read through it, page 35, a treatment. Yes, good. Right, Dr. Mavish, would you want to ask anything?
No, I have not prepared this station before, so I had no
That's
idea
all
what
right.
it was about.
If you know the examination, then the most important thing is paying attention, being available, being focused. That's all. If you would have been focused, then you would have realized that it's not about the leg or lower leg, or it's not about varicose veins or claudication. It was about the foot drop. Then you would have managed it.
No, ma'am.
Yeah.
Honestly, I had also not done it, but because I was not in her position, maybe I would have
Yeah,
said the
that's
same
fair.
if I was asked. But because I was more relaxed because I was just looking at the thing. Because when you just look at the first two lines, you were like, maybe it's varicose. But then that was only the operation the patient had, and then they
Yeah.
said patient
Then I
it
wrote
said it's
in
neurological
particular to
exam.
rule out foot drop.
Yeah.
So
Yes.
it will become
Yes.
more clearer. Yes, Dr. Abhishek, please. Dr. Abhishek, you want to say something? And then Dr. Asra, they were also writing and they were telling you people as well. They were telling
Yes.
Dr. Mavish. So that's why
Yes.
you picked it.
Yes, I got it as well. I thought that it was neurological, but when they said it's
No.
neurological, I said I'll practice it, so I'll do it because otherwise I was also
How
not
come you
familiar with this.
didn't read? Reading is more important. What's been given to
Yeah.
you. Otherwise,
Yes.
like you
Yes.
can make, you know everything, but like simple mistake can make you do the whole station wrong. It's just like being
Situation, it
focused.
is very difficult as well because one is stressed, and I think every time they keep on changing the
Foot
they can
drop has
put
been
any.
foot drop has been in exams before, because many of my members, they told me that patient was young girl and they had to do the examination and this happened and that happened, and so this comes quite often. Yes.
What she did. So the examiner would have told her, "Have you understood the question again, or read the question?" When she started
Yeah,
going off
but
course.
that I do as well. When I give them 1 minute and say, if you've read and understood, kindly begin your examination. I say
Yeah.
that as well, but then I don't know if they had read and apprehended exactly what it was written. That I don't know until they start speaking, talking.
Hello, ma'am.
Yes. Yes, Dr. Abhishek.
I just wanted to make something easier for Dr. Astra, like
Yes,
these two
please.
examination, like foot drop examination and spine and lower limb examination, these two has similarity. Today you have examined really well, but like you could not do the hip one SLR thing and the hip plate would avoid that is only Just the spine and lower limb examination, it covers also the foot drop examination. But in hip drop examination, you just focus on the foot. So within given time, you can manage all the things.
Yeah.
Like for
Okay.
this session, this ankle and foot with the system. You will be provided with the neuro tape and the hammer, something like differentiate from ankle sprain. Okay.
Yes.
And second thing is, whenever you see something like any injury occurred in the past, so you drop and focus on the foot first. You have checked the gait first, then checking the after doing the inspection one, you can do it down on the couch. You can do that. So focusing local temperature, tenderness, pulses. You can see the pulse, ADP, posterior tibial, and the popliteal one. You can also check the popliteal mass. So just below the thigh, you have to focus. You don't have to go to the
Okay.
Then the most important thing is Tinel's test, tapping over the fibular neck where the common peroneal nerve starts. If there is numbness, prick, sensation over the foot or not. And for temperature, you have to start from the fibular neck also along the course of the peroneal nerve. You also have to squeeze metatarsophalangeal joint for checking that and take tenderness in the bony prominences like medial malleolus, tendo-achilles, around the ankle joint and all the things. And then do the neurological ones like sensory, motor, tone, coordination, and reflex. That completes the examination. And for spine and lower limb, start from the spine, then the hip, then do the rest of these foot things. So this will actually, this is the basic difference between these two sessions. So spine and lower limb examination, I think if we are asked to do the both spine and lower limb, it's really barely we can cover it within 6 minutes. But the for foot drop, if you just avoid the hip one and do the do below the foot all the things, you can manage it within time. So that is the basic difference I'm just saying.
Dr. Fisher, I understand. One thing I want to ask is that for this station, because one of the major differential will be sciatic nerve injury.
Yes.
Yeah.
Yes. Yes.
So sciatic nerve, common nerve, all pathology or central pathology.
I think that is why it is important from the movement of the patient. We determine if there is problem with the sciatic nerve. You understand?
Yeah.
Which will be
complete we can check that. Here the main complaint is foot drop. That's why I'm focusing on the foot. So if you can manage time, you can check the hip better. But if you do the hip, do the spine and all that, you will not have time to,
I think
Doctor.
I think this after movement, I will to neurological examination from checking tone, as quick as possible, then muscle power, quickly, then to everything, below the knee. Then you forgot something during your presentation. You should have said that you would like to complete the examination by examining the hip joint,
this is important,
and the spine.
Of course.
And complete the joint. So that is very important, because even if you forget to do examination of the hip joint, after mentioning it, then you are covered.
Yes, this is what I was actually about to say to Dr. Asra. Dr. Sunday said that, say it in your words that I'd like to complete my examination, checking this, then it would cover.
Yeah, she did great.
Yeah, I agree with Dr. Ishfaq. Yeah, we just want them to be perfect.
I am just concerned about time. I am just concerned about time. That is my main concern.
Yeah, she did well.
Everything. He touched all the point, but if we can thank the patient by doing all this before 6 minutes, that would be much better. Then my focus